what should every player really be implementing to kind of stay strong, to stay balanced, and to stay injury free?
Well, there's two things. You need to be doing movements that mimic the movements you're going to do on the court. So
Yeah.
when you're off court training, which you need to be doing, you need to make sure you can meet the demands of your sport. And in tennis, it depends if you're playing singles or doubles. Is there going to be a lot of running or not as much running? You need to make sure you can do those movements over and over again. You're
Yeah.
We know based on research, if you work out in the morning and you sit all day at work, you've just negated that hour at the gym in the morning. So you need to make your everyday workplace environment body friendly with lots of micro breaks. We know that you'll be more productive at work if you take these micro breaks. If you're not using a standing station, sitting all day is definitely going to impair your ability to be healthy on the court. So we have to take care of our bodies all day, not necessarily adding things in, but just maybe changing the way that we do things, taking that break at lunch and going for a quick walk. But I would say that looking at your entire week and figuring out how you can not detrain your body by either a sedentary job or not doing the proper exercises in the gym that mimic what you need to be doing on the court.
What do you see the biggest mistakes that players make when they're trying to accelerate recovery, either after an injury or a really tough match?
Well, I see that they one of the things that they don't do is they don't have a written plan. So I think having a written plan for for your training program, which includes pre-match, which includes the week before the tournament, everything needs to be written out. To me, if it's in writing, it's easier to follow. Making sure that they go in to the tournament or to the match prepared. Whether you're measuring your HRV, heart rate variability, to see if your nervous system is ready, it's basically, is your battery fully charged?
Hmm.
And if your battery's fully charged, you're going to be able to make it. If you go in, if you've had a recent illness, a cold, your battery's going to be depleted. And this is where we see people cramping. And once you've cramped or experienced some heat illness, you've lowered your threshold and you're more susceptible for weeks, maybe even months after that. So I think the preparation going in is more important, and you can't do it during the match. You can't do it morning of the match. It has to be done. It has to be an ongoing process. It has to be kind of almost like a way of life.
Are there red flags that players and coaches should never ignore when it comes to, they're feeling some kind of discomfort or pain?
So I would like to tell people pain is not a warning sign. Pain is not a yellow light. Pain is a red light. It's a stop sign. Okay. Pain isn't, it's actually an output by the brain, not an input. So this is why everyone's pain levels are different. So if you're not properly training and recovering, then you're going to be more sensitive to pain. So if you're starting to feel discomfort and you realize, I'm overtraining, I just traveled, I haven't slept well, and the hotel bed was terrible, you're going to be a little more sensitive to pain. Your pain receptors are going to be a little more sensitive, so keep that in mind. But pain is there to protect you. It's your brain's number one job is to keep you alive. So we have to pay attention to these warning signs or these signals from the brain that say something's going on. So we don't want to ignore anything. This is not pushing through, especially on court. Um, you don't want to push through anything. You want to pay attention to your body and pay attention to these warning signs or stop signs, as you will.
Yeah, definitely. And there's a lot of strategies, that you and I use, right? Like dry needling, blood flow restriction, laser. So can you explain, like when and how these tools, can really be most effective?
Great question, Lisa. So trigger point dry needling, you and I spent the first half of our careers without it because it wasn't around, and we used our thumbs and our elbows, and we were
Yep.
very effective. And now for the last 17 years, we've been using a solid filament needle. This is not acupuncture. This is physical therapy, Western medicine. We want to be very clear. We are inserting this needle into a myofascial trigger point, which is a knot in the muscle. You can picture the entire muscle contracts, the entire muscle relaxes. However, there's a thread that stays in a knot, and that's a trigger point. And trigger points are very painful. They will limit that muscle's ability to produce force. They will limit mobility. They will cause compensatory movement patterns. So when we insert the needle and release the trigger point, we are we're really affecting the nervous system. We're affecting pain. We're instantly restoring range of motion, firing patterns, mobility, and balance in the system. Now, we still need to address why they occurred. So dry needling should not be an a la carte, like a mani-pedi dry needling. No, it needs to be part of the entire rehab process.
Exactly.
And so please don't go to a physical therapist and ask for dry needling as a standalone item on a menu, because that's
Yeah,
not how it should be effectively used. And I'm glad I have the opportunity to talk about this because I hear it on a weekly basis.
me too.
But it is a very, very, very effective tool for getting in and making change quickly. Uh,
Yes.
so it can be used in recovery, it can be used in performance. I have a lot of athletes that like needling, dry needling for maintenance. Now we still are going to address the whole body and the whole picture, but it is a very quick, fast, and very effective way to make a change in the muscle and in the nervous system. And we can touch muscles with a needle that we cannot touch with our hands. I work
Mhm.
with a lot of offensive linemen that are over 300 pounds, and my elbows and thumbs are not strong enough to make a change. Now, with the needles, I can. And there are other
Mhm.
muscles in the body we just can't touch, but we can insert a needle and reach them and make a change. So dry needling it's a great tool as part of a whole rehab and recovery process that we can use. The other thing you mentioned, which is an amazing tool, is called blood flow restriction, or BFR. It can be used in the rehab process because when we put the cuff, which is a tourniquet-like application, on a limb and exercise, the muscles will respond like we're lifting heavy, but we're not lifting heavy. So the muscles get a stimulus of a heavy lift with still protecting the joint and the injured area. So it's used in rehab that way. And the other way it's used in recovery, it's a full compression, um, full inflation, full deflation for a 25-minute cycle to help flush the limb. And especially for the legs that get really, really heavy, it's a great way for legs to recover. So that's a tool. And the most effective units, they make some units you can use at home. The most effective units are the units you would find in the clinic, but either way, it's a good tool. It's a good tool. The home versions people can travel with. So it's a good thing to have on the road if you're a traveling athlete, or to have at home for recovery. But that again needs to be, you need to be shown how to use it by a professional that's trained in blood flow restriction techniques.
So what's the difference between rehab and prehab, right? Are there specific exercises or mobility routines that really should, we should be doing even when we're not injured?
Right. So rehab, we think of rehab as you've had an injury, you've had surgery, you rehabilitate the part. Prehab, we will do prehab on people if they're going to have surgery and we are getting them ready for surgery. That's prehab. But if you're looking to prevent injuries, again, your overall fitness program should be based, and your mobility program that you would use as your warm up needs to be based on your individual needs. And because most people have sat in school and then sit for a living, the hip area is one area where people lose their mobility the most. So
Mhm.
hip mobility, I would put near the top of the list. And then the other thing that will help, the foot hits the ground first. And so if we don't have a lot of mobility in our feet, we will not have mobility in our ankles. And if we don't move through the ankle, we're going to move excessively through the knee, the hip, or the low back and have a problem there. So we are using something called the Toe Pro in the clinic, and patients will get one for home. It is a nice device where you can do some lengthening and strengthening of all the tendons and the foot and ankle. The foot in particular is made up of very few muscles, mostly long tendons of the toes that travel up and have their muscle belly in the lower leg
Mm-hmm.
underneath the calf muscles. And so making sure that we keep these toe and foot and ankle muscles long and strong is really, really important. There's a lot of research that shows the fastest people in the world have longer, great toes. And
Mm.
if you're over 70, your chance of falling is significantly reduced if you have good toe strength. So
Mm-hmm.
using the Toe Pro, and it's just a little foam device, but when you see it there, you're like, okay, I'm going to do my Toe Pro exercises. It really helps you work on things. We combine that with education on shoes. We have gotten
Yeah.
into a very cushioned shoe world, and the further your foot is away from the ground, the less you are going to feel the ground, the less you're going to sense the ground, and the more substitution you're going to have up the chain. So we need to bring the feet back to the ground, not necessarily barefoot, because we've lost a lot of our padding and we work and live and train on very flat, hard surfaces. So we need to have a little cushion, but less cushion is better. And the last part about the shoe is having a very wide toe box. The shoe companies are slowly going to change. They are a big, big industry and they want to make money, so they will change, but we might not want to wait for them. We want to look at the shoe brands that are already starting to change. I like Ultra, they ALTRA. They have a very wide toe box. The more spread out your toes are, the more
Mm-hmm.
ground you're going to feel. And if we
Mm-hmm.
squish our shoes, our feet, even our tennis shoes, if
Yep.
we cram the toes in, we've just lost surface area. It's like we're standing on half a foot instead of a whole foot. That's going to affect our balance. It's going to affect our firing patterns from the ground up. Shoe wear is very, very, very important. And that goes for when you're not in your athletic shoes as well. Getting into a
Mm-hmm.
Birkenstock or a shoe that lets you feel the ground, that lets your toes spread out, that lets the muscles in your foot and ankle do their job is really, really, really important.